everybody. I'm Dr. Usry, and welcome to All About Health and Wellness. We're brought to you today by All American Wellness and by the efforts of Podcast Junkies. That's Podcast Junkies, Junkeeze. It's very easy if you want to get your message across to the public by contacting Christian Perillo, Ben Castro at podcastjunkies.com so you can get your message across. Today on All About Health and Wellness, we're going to talk about auto accidents. Of course. Why? In our clinic, this is what we specialize in, and this is the protein of the protein, fat, and carbohydrate diet. So we're going to talk about what happens when you have injuries. Did you know that the cervical spine is the most injured part of your spine whenever you have an automobile trauma? And the brain is also the most injured part of your body. Why is that? Well, think about your safety harness. That 3-point safety harness straps in your torso, straps in your pelvis, but it does nothing to keep your cervical spine guarded and secured. You have a headrest, but for most people, the way they sit in their seats, there's a great deal of distance between their head and their headrest. And that will certainly be protective if you run into something or someone runs into you. But if you're hit from the side, there is no giving you protection or giving you safety. It just causes tremendous damage to the cervical spine. Literally, your head slams into different areas in the vehicle at times, but your neck goes rocketing forward and backwards or side to side or even some type of rotation. And this is no matter whether you're hit from behind, you hit something in front of you, or you're hit from the side. Your neck travels at very high speed multiple amounts of times, and your brain is literally slammed against your skull multiple amount of times. This kind of trauma can create catastrophic injury, and luckily, or hopefully luckily, it'll be picked up by the emergency medical services and the emergency room, because this kind of injury that causes laceration to your brain can be catastrophic. So once they've ruled out that you have a catastrophic injury, they'll do a CAT scan, they'll do an MRI, and if they don't see anything anatomically different than it should be, meaning the brain looks normal, and at that point, you're not deemed to have an injury that is going to create a life-threatening problem, they release you, because that's the purpose of the emergency room. Do you have a true emergency? If not, you're released. Many times in pain, and absolutely many times with dysfunction. And today we're here to talk about that. Have any of you heard about the autonomic nervous system? Well, most of you haven't, but there's a lot of talk nowadays about the polyvagal theory by Stephen Porges, who wrote a really very informative book about the vagus nerve system. In case you don't know it, the vagus nerve system is part of your parasympathetic nervous system. It's actually the longest parasympathetic nerve in the body, and it's part of the autonomic nervous system. Well, what is that? So let's talk about the autonomic nervous system, because we have it with us constantly. It is the way your brain controls and regulates all of your organs, all of your hormones, all of your blood vessels, all of your muscles, every visceral organ that you have. And when we have it functioning normally, we function well. When it's not functioning normally, then we have problems. So let's discuss it a little bit. You have this autonomic nervous system. It's in two parts. You have the sympathetic system and you have the parasympathetic system. Let's go over an example of the sympathetic system. You're driving along and all of a sudden you see the lights in your flashing lights in your rear view mirror. Instantly you know you're being pulled over by a policeman. Right away your mouth gets dry, your heart starts beating rapidly, your hands get moist, your stomach and abdomen's making noises. And this is the autonomic nervous system feeling a threat, so it kicks in the sympathetic nervous system. What else kicks in the sympathetic nervous system? Having an automobile trauma, having thousands of pounds of a car running into your car at such high speed, all of this damage is created within seconds. Your body just can't seem to process it properly. And many of us get stuck in that mode. We're stuck in sympathetic mode. Let's look at the opposite of that, the parasympathetic nervous system, which is the system or the mode in that system that we should be in always. Very rarely do we need the sympathetic nervous system. We need it if we're exercising at the gym, if we perceive a threat and we have to run away, or for some reason we can't get out, we can't talk our way out of it, we have to get into a fight. We go into sympathetic dominance, and that is very, very stressful for our body. When we perceive a threat, we go into that stress mode. When we're in parasympathetic, we're relaxed. To use a colloquial term, we're chill. Everything is just smooth and easy. We're laid back. All the circulation to our organs is centrally located. Our heart rate slows down. Our blood pressure goes down. And we are now able to rest, relax, rehabilitate, recoup, and once again have resiliency in our health. When we're stuck in sympathetic dominance and we've been involved in a car accident, which is very, very common, we don't heal well. We don't respond to the therapies no matter where you go. So how do we handle that? There are a number of different special techniques that can be used to help that person who keeps reliving the trauma over and over again, to rid them of that out of their emotional system. And it can be done in just a few minutes. And it's miraculous how it changes how that person responds to care. We do that by working on the mesolimbic system through the acupuncture system. And we normalize that autonomic nervous system. And once again, those patients are able to heal well. Now, back to the autonomic nervous system one more time. Once we get that person established back into parasympathetic mode, now they are able to utilize all of those therapies that we use to get them back to normal. We have a special neurological technique that we use that works on what we call the long tracts of the central nervous system. In your spinal cord, you have a lot of different nerves that are sending messages from the spinal cord all the way up to the brain. And three very, very important nerves called the spinal tectal, the spinal rubeo, and the spinal thalamic nerves are all sending messages that need to be reset because they're firing off in the brain and causing a lot of neurological dysfunction. There's a few special techniques that need to be done, again, to get the brain to heal and come back to normal. Your hypothalamus and your thalamus, your mesencephalon, your tectum, they all require to be reset once you've been involved in a car accident, and that has to be addressed for you to receive treatment effectively. That's a special technique we use. There's another one we use, and if we could just look at this for a moment, this is a laser. Laser is a healing light. Laser stands for light amplification through systematic emission of radiation. It's an acronym. And what does that mean? It sends out a light, and everything that we see has to do with wavelengths. People have asked, well, why is the sky blue? The sky is blue because as you perceive it, it's the easiest wavelength for you to look at and to recognize. But we have wavelengths that are all the different sizes that fit all the different colors of the rainbow. This particular laser uses a purple light and a red light. The red light is 636 nanometers. What does that mean? It's the wavelength of the light. This purple light in the class 3 laser is a 405 nanometer light. That's the wavelength of purple. So this has tremendous healing effects by sending this healing light into your tissues and normalizing the cells and working on something very important in your cell. Can you guess what it is? That's right, the mitochondria. The mitochondria is the powerhouse of the cell. If you have the powerhouse of the cell working properly, your cell can start to function normally. It's damaged when you have trauma. So getting that to heal is very important, and this is why we use class 3 laser. We've been using it since 1997, a long time. And there's been a lot of development of different kinds of lasers out there. There are class 3 lasers or cold lasers, which is what this is called. There are red lasers and purple lasers, which is one of the examples here. There are class 4 lasers that use a long wavelength, and it's red. It's called an infrared wavelength, and that is very long and takes a lot of effort to get into the body, so it creates heat. And there are times where heat is appropriate and times where you don't want to use heat. The class 3 laser or cold laser doesn't produce heat, so it can be used for acute problems. It can be used for chronic problems. It is an all-around tool. Ladies and gentlemen, I'm doing this 38 years. I'm in the healthcare field for 38 years, and this is the most miraculous tool I have seen or utilized for years and years and years. It is just a miracle machine, and it's available in a lot of different offices, quite frankly. Whenever you're looking to find an office that provides physical medicine, you want to make sure that they have a class 3 laser so that they can use it on you. So what do we do, once again, to recap, to normalize the autonomic nervous system? Put you in parasympathetic, get you to relax, rest, recuperate, and rejuvenate. We use the class 3 laser on your brainstem. We use a special neurological technique that has to do with working with your acupuncture system to normalize those areas of the central nervous system that go directly to your brain. Now, what else do? We use acupuncture. Oh, and a lot of people tell me, oh, no, I don't want any needles in me, doc. And one of the reasons is your experience with needles is having someone draw your blood, having your doctor give you an injection. Those needles are really thick. So let me give you an analogy. A needle from a doctor giving you an injection and a technician taking your blood is like the trunk of a tree. Acupuncture needle is like a twig. They're very, very tiny. They look like a hair. Many times when we use acupuncture on the patients, they're all set up for it to be painful. I put it in, and they ask, well, are you going to do it? And I tell them, it's in already. It's in? Yes, it's in. And what does acupuncture do? Acupuncture taps into the energetic system of our bodies. Acupuncture is a healthcare treatment and diagnosis system that is 5,000 years old. It has certainly stood the test of time. Modern medicine wasn't really, I don't know what you would call it, wasn't really brought to the point where it's consistent and you can trust it since 1910. Chiropractic's been around since 1892. All of those systems that we just talked about are new kids on the block compared to acupuncture. So it's very, very helpful at making sure all of the energy in the body is flowing properly. How important could energy be? I don't know. Why don't we ask Einstein? E equals mc squared. Everything is energy. Energy, slow moving, light. Energy, fast moving. So energy at the speed of light is extremely healing, and that is why we use lasers. That is why we use needles to get the energy within the body to heal. So, for those of you who think you may have an issue where you're sympathetic dominant, where your vagus nerve isn't working properly, well, that is addressed by using laser therapy, by using certain techniques that tap into the acupuncture system without necessarily using needles, but just using those highways of energy known as meridians and using those tools properly to get you out of that sympathetic dominance. So, once again, your body can function normally and you can have optimum health. I know a lot of patients that come to see me, and I talk with a lot of other colleagues who are chiropractors, and many times these patients that come in all banged up with all sorts of different problems neurologically and biomechanically, they once they get past that acute aspect of the injury, other areas of dysfunction are addressed and they can start feeling even better than they were before they got into the accident, but would rationalize why they felt a certain way and weren't working on optimum health, right? We always have rationalization for why we feel the way we do, even though we know we're not functioning at 100%. This is what chiropractic is all about, making sure your nervous system functions properly. We all have different ways of going about it. Some do neurological specialties, some do applied kinesiology, some do sports injuries, some some do just working with internal aspects of dysfunction with a lot of emphasis on biochemistry and nutrition. We all go about the same route, getting you healthy, helping you with wellness so you function normally. This is what we do at All American Wellness. This is what all chiropractic centers do. So if you're thinking, I think I should try a chiropractor, by all means, you should do so. I'd like you to come see me, 561 863 8779. We offer a free 15-minute evaluation to see how you're functioning. And if you're not functioning well, we'll go ahead and tell you what you need to do to get to optimum health. If we see, unfortunately, that you may have a disease and pathology, we'll refer you to the proper physician so that those issues can be addressed. Anyway, we've talked about the protein, which I told you about, the auto accident, and then the meat and potatoes, the autonomic nervous system, the sympathetic versus parasympathetic dominance. All of these things have to be addressed when you're involved in an automobile trauma. And it's very important that we get that autonomic nervous system back to normal so you once again can function normally. Well, that's it for today. I hope you're joining us weekly on Spotify, on Apple, and on YouTube. Remember, it's all about health and wellness. Look for us. We're there every week. We're really anxious to tell you about many other things other than automobile accidents, things that you can do to have optimum health. That's what it's all about. Not the years in your life, but the life in your years, right? We always want to be tip top in our function. Well, this is Kevin Usry from All American Wellness through Podcast Junkies. I thank you for joining me. I'll look forward to seeing you next week. Bye.